Hello viewers, I'm Dr. Janani. I'm a psychiatrist in TTK Hospital, and with me is Soumya. She's the Chief Operating Officer in TTK. Hi Soumya, how are you?
Hi Janani, fine, thanks.
So today we're going to be discussing about interesting perspectives of addiction, be it alcohol and be it drugs. So Soumya, we've been having some interesting discussions, and I thought today we could talk about craving. Isn't that a very integral part of addiction, isn't it? So how do you psychosocially handle craving in patients?
See, we have sessions directed towards addressing craving in individuals, be it psychoeducative session that actually brings them an awareness about what cravings actually are, and group therapy sessions and personalized sessions to address individual craving, and of course, the triggers, the internal, external triggers, and what for individuals, what are the points where, how the craving sets in, for them to be aware of how the craving sets in, and high risk situations in an individual's life. Now, when we talk about triggers, there are internal and there are external. Internal can be, any kind of fights and that is triggering him, or if he looks at there's some situations that sets off an internal trigger. External trigger, again, if it's a party, and of course now social media has a big influence, and everything is normalized, right from alcohol use, partying, to substance. It's all being normalized. You look at any social media handle, or when you look at movies on the OTT, they just normalize even substance use. There's not even a warning sometimes, right, that viewers' discretion is to be exercised. So yeah, so that's how we address craving through all these aspects, and I'm sure, like, for each individual something will resonate. At some point, sometimes in group therapy sessions, he's able to resonate with certain aspects, and individual sessions, when he goes in for counseling, he's able to address that with his counselor. In psychoeducative session, there is an awareness of what craving is, which they've not really paid attention to, and they're able to address that again with their counselor. So that's how we address craving, and how to manage cravings once they're in their recovery.
And it's such an important part of recovery, isn't it?
Yes, it is.
Sometimes I feel it is the most important part of.
When a patient gets admitted, of course, his craving is going to set in alcohol the very next day, and with substance over a few days. Now, the main foundation that we're able to work is when you give them the meds. And that is, we are able to manage them, because, there are some meds to support for them to settle down their withdrawals and manage their cravings. Can you throw some light on how you approach craving, medically, and how that is handled?
Craving is actually a very complex symptom, I would say. It's an emotion, isn't it? Somebody craves for a particular substance, meaning at the cost of anything, they go in search of that particular substance, be it alcohol, be it drugs. They sometimes don't even realize, or they fail to realize the consequences. They don't look at anything else. So the fact that they're so drawn is such a complex behavior. So like you beautifully said, I think it requires psychotherapy, but there are certain medications that can aid in the process. So for alcohol, there are certain anti-craving drugs that we can give, which helps in reducing the amount of craving that a person may have. So for some, it completely prevents them from drinking or taking drugs. And for some, it actually reduces the amount or the frequency or the quantity of that particular drug. So there are anti-craving which we use for drug users. Sometimes in TTK, as you know, we see people with polysubstance, so they have multiple drugs, and they're craving for one or the other, and like you said, it just sets in like that, and that initiates a cascade of behavior that's very hard for us sometimes to work on. But I think with the aid of multiple medications, sometimes we calm the person down. But I feel craving is it's also, it's a work in progress, isn't it? It's not about a day or a 2-day affair. It goes on even after the person gets discharged. We keep talking about craving every time they come in for reviews. We adjust medications when they come in for reviews to make sure, we've contained that, at least from our side, as much as possible. So I really believe it's a work in progress. So Soumya, most people believe that once they've been treated, especially as an inpatient, they're done, that they've completely recovered, and they're never going to go back to the substance. And many families also believe that. But what do you think? We know that relapse is a part of this entire process.
Yes.
But what are your thoughts?
Unfortunately, not true, Janani. As much as there a lot of hard work that they've put in, it's not the case. Relapse, there is always a fear of relapse, and it's not that relapse will happen immediately after recovery. Sometimes they think if they've been sober for a while, there is no chance of relapse. The fear of relapse is always there. And relapse is like, recovery and relapse are two sides of a coin. And sometimes relapses happen in the journey of recovery also. So as much as we work towards, recovery, we also work towards preventing a relapse. The patient and the family is given a lot of awareness about relapse and how to prevent it. And not only that, if there is a lapse or a relapse, how to handle it, right? So that awareness is given to the family. It's not like we make them, they're made to believe that, once they're treated, they are free from addiction for life. They're empowered to identify relapse and manage, of course, prevent or and identify if there is a relapse or a lapse and how to handle it.
And I think medications also play a role in that, isn't it? That's why we're very cautious about any reduction in dosages. So many patients come up, in their first review or
and
second
say,
review.
yes, and they ask you to reduce medicines. Absolutely. Because they think like, they put, the addiction beyond them. So I've seen that resistance, Janani, when they come to you and they've been sober for a while. Correct. Though the counselor and the team feels that there is a risk of a relapse, and they do, there is a unsaid pressure to taper off meds. So how do you deal with that?
So it's a very pertinent problem. So nobody wants to be on medications. Generally, most people don't want to be on medications. So it's a question that I'm asked in every review. Would you be reducing any of my doses? I've been sober for so long. Why don't you consider reducing? I'm free of craving. I have no, any thoughts and all of that. But like you're saying, it's work in progress. We need to work with the patient. We need to work with the family. It's not that we're against reducing medications, but unless, the treating psychiatrist is comfortable with, the
tapering
fact that,
it off, yeah.
I can taper it off at this point. So it's a very slow taper. You taper, you review, you taper, you review. Just like how we have these review sessions with patients in psychotherapy, you've got to, do it very slowly. But most patients are sometimes impatient. They want like a quick reduction of doses. But it comes, I think, with psychoeducation, with explaining why it's important, because these are all drugs that cross the blood-brain barrier. They're making changes to the brain. So it's very important that the withdrawal, as much as how we take time to increase, the decrease also needs time. So education, I feel, helps there.
There's one more question that I'd like to ask. How do you address questions on side effects of medication? Because the minute we talk about medication, the patient and the family asks about side effects.
Absolutely.
So how do you handle that?
All the more in psychiatry why they ask, because I think there is a fear, I think it's a worldwide fear of becoming hooked onto the medications in the first place, a belief that psychiatric medications are for life. Sometimes a misconception that psychiatric medications will make them dull, will make them very drowsy, will not allow them to function. So this is a question that I get on an everyday basis, and sometimes I decide to answer it even before they ask me the question. So I think it again comes with explaining to the family the purpose of the medication in the first place, how it's going to help them, how long it's going to take, to give them like a ballpark figure of how long they might be on medications and why it's important, with rapport and with education. And once they start seeing the difference on medications, people are a lot more compliant and more understanding of why they need
it. Isn't it ironical? They're taking substances in one end, and they're worried about the side effects of medications. There's a big irony there.
Very true.
Yes. So Janani, when we when we're talking about medications, are there any other medications that support in while you are treating patients for addictions?
Definitely, apart from our anti-craving medications, I think what really helps is also addressing the comorbid psychiatric issues. Let's say a person is depressed, an antidepressant really helps. Anxiety, anti-anxiety agents. Somebody with a mood disorder, you need to look at mood stabilizers, which are very, very important. Because if there's a psychiatric issue in the background, that may or in itself cause a dependence. Sometimes, many a times, we've seen that the person actually has a psychiatric illness that has pushed them towards a dependence. They come in for the dependence, and when we treat the psychiatric illness, the dependence automatically settles. And every time there is a relapse of the psychiatric issue, they start getting into the substance again. So it's very, very intricately connected. So it's very important to look at comorbid psychiatric issues, which are prevalent in most people within addiction, either this leading to that leading to this, or being there together at the same time. Soumya, what are your thoughts on women and addiction? I mean, of late we have been seeing women coming to us for help.
Women are as much impacted by addiction like men, but unfortunately there's a lot of stigma, especially in Chennai, right? They don't come out to seek help, and families also don't encourage. It's looked upon as a big moral failure, a failure in character, and the families also try as much to just put it under the carpet. And women, in a year, when we have to compare, we hardly have about 1% of compared to, maybe we have about 10 patients in a year who seek help, who are women. There again, we are not talking about, we are not talking about the moral values, and we're not putting them on the same scale as men. And it is as much as a problem for a man like for a woman. And it is really sad that the family doesn't address that, and many times it just goes unnoticed and untreated, and it only progresses to other serious comorbid conditions. It's really sad, but I just wish that families are more aware and bring and seek that right help for the women grappling with addiction. It's not only substance, right? Alcohol or substance. There are women typically who've gone through a perimenopause and menopause, and they would have had sleep issues, and where they would have started on some sleeping pills, and over a period of time, there is an addiction seeping in there. We've seen such cases, and when we highlight the addiction, there is so much of a denial even with the family that they fail to seek the right help.
All the more why I think it helps to look at addiction as a disease. So very much, where we look at addiction as a disease, and so as something that is caused in the brain, and so not as what you said, as not as a moral failure. That's something that requires to be looked at. Just like how a woman can be a diabetic or a guy could be a hypertensive, anything like that. Yeah.
So Janani, as a closing message, can people truly recover from addiction?
Absolutely. I think they can, and there is a lot of hope, provided they get the right sort of help, provided they get the right sort of support. Because I don't think this is something that one man or one woman can do by themselves, isn't it? What do you think?
Absolutely. We have so many patients who've recovered, who've had really qualitative recovery, and who've also come back to give back, right? And to encourage people and give them that hope here. And I think it's, as a society as a whole, it should become a movement to kind of support families and individuals grappling with addiction. Now that substance abuse has become very rampant, I think it is the onus is on the society as a whole to give that support system. And I think definitely there is hope.
Thank you, viewers. I hope this has been an enjoyable session, and I hope there are some take-home messages. Do share your feedback and let us know.